So I'm going to introduce now our next keynote talk. Nicole Miglio is going to present on gestational phenomenology, or why we should distinguish between pregnancy and motherhood. I would like to say a few words on Nicole's work. Getting there, I promise. So, Nicole is a philosophical practitioner, an independent researcher, formerly a postdoctoral fellow at the University of Milan, at the University of Haifa, and a visiting scholar at Penn State University. She holds a PhD in philosophy with a specialization in feminist philosophy, a phenomenology, during which she researched in the US and UK. She published peer-reviewed articles, among which in journals such as Phenomenology and Mind, Punta, Journal of Phenomenology Research, and she wrote two monographs, Gestational Phenomenology, the Intercorporeal Experience of Pregnancy, which is about to come out for Bloomsbury, and The Hoax of the Fetus, which is another fantastic book I had the fortune to read, which is going to be published soon by Meltemi. So please, let us know.
Thank you so much. Yeah, thank you. Thank you, Professor Ferrarello, for this very, very kind invitation, to all of you students and other fellows of the faculty for joining us. Today, I just want to discuss with you just a little bit about this idea of gestational phenomenology. The research I'm going to present to you is part of my PhD thesis, which I submitted in September 2021. And later on, I wrote a full manuscript and monograph that it will be out in a couple of months. And this talk actually focuses on the, let's say, theoretical background of the whole investigation. So I'm curious about what you guys think about that. And if something is not clear, I really not only recommend, but also ask you to engage with me and to even challenge what I'm telling, because it's all about that at the end of the day. So I would like to start with a substantial objection. And during an informal conversation back in 2021, a male professor once told me that there is no philosophical value in analyzing the process of pregnancy, and that, as opposed to birth, pregnancy is merely a subpersonal process, so properly the terrain of hard sciences. I was, talking with them about my research, and I was really enthusiastic about how pregnancy may help us to rethink our notion of subject, self, and body in Western philosophy, and specifically, I'm talking about phenomenology and 20th century philosophy. And it was like, you know what? No one really cares about pregnancy. Birth is the category, is that philosophical concept that may help us to understand better ourselves and our intersubjective encounters with alterity, but pregnancy really. So at that time, what was really clear to me is that he implicitly subscribed to a certain idea of intersubjectivity and human being. This idea is that birth is the origin of all intersubjectivity, and nothing of philosophical relevance can happen prior to this event, so during the pregnant process. Of course, one may see that in pregnancy we witness at least the presence of two subjects. One subject is the pregnant self, and for this professor, the pregnant self wasn't really a subject. So it wasn't just, a woman carrying something. And the other subject, and of course, this is a quite problematic and very difficult topic to disentangle, is a living being, is the embryo, is the fetus, and they may eventually become, in some stages of pregnancy, a person. But what is, again, interesting and totally not included in the professor line of thought was like, in some sort, pregnancy was and is already an intersubjective kind of encounter. So according to his reading, pregnancy should be the object of empirical investigation and of psychological inquiry, but it does not have any philosophical value. So this is the very first thesis as I'm going to present and potentially discuss with you today. Let's agree with the fact that pregnancy is not something one may want to exploring phenomenologically and more generally from a philosophical perspective. But why that? And yeah, that's the line of thought. Birth is the region of intersubjective encounters. So intersubjectivity per se requires that living beings is in this world as, let's say, discrete bodies in reality. This implies that nothing interesting happens for the self during gestation, and then that pregnancy has no philosophical interest. Well, that was interesting for a specific reason that has to be related with what do we count as philosophy. So what is philosophy, and what are the topics that we may want to explore from a philosophical perspective? Because it seems to be that its objection was exactly about that. What is worth it to explore philosophically? And I found plenty of confirmations of this, let's say, doubt in some sort that arose in me, is that the pregnant process is excluded from the philosophical canon or the philosophical sets of topics and issues that we may want to expect to have, let's say, some philosophical dignity in some sort. And the philosopher, phenomenologist Jonna Bordmark gives us quite a precious and interesting suggestion. The problem, I quote, is not that pregnancy may not be a philosophical topic, but rather that pregnancy has not received much attention in philosophical discourse. So, according to her analysis, it is due by the fact that the very subject involved in this process, in this event, who is the pregnant self, is not a self who has been active or even present in the history of philosophy. So the absence of the pregnant self from philosophical space, according to our view, is motivated and understandable from a double reason. Not only the pregnant self is a woman, and it opens, of course, plenty of debates about do women do philosophy, but also she is involved in reproductive tasks. So she's a woman, and she is in a process that, if we want to follow, for instance, Simone de Beauvoir understanding, in a biological process that overcomes herself and her own subjectivity and personality. So, in Bordmark's view, I quote again, the focus on birth as a starting point for intellectual life expelled pregnancy and the life of the fetus to a purely biological sphere without philosophical interest. So, come back to the slide. The effacement of the pregnant process from philosophical investigation is in some sort symptomatic of an overall elimination of women's perspective and lived experience from it. So in some sort, what I would like to do with not only today's talk, but with the whole book project, is to propose a strategy for reprising the maternal origins of the self by amending what Lucy Rigaret described as the matricidal move at work in Western philosophy. And this is a quite, unproblematic point. The point is, we all came from a pregnancy, and we may want to explicitly take care of this aspect of our, let's say, prehistory. And okay, so not only that my kind of, when you study for years, some topics, they become like super important in your life, but I found that it is also for other researchers. I'm not bringing many literature today. I'm just quoting Dermot Morant, that you may be familiar, I mean, a phenomenologist who you may want to know if you are not familiar with this work. And he actually say that, I quote, from the point of view of Genesis, all humans experience the original intercorporeality of living and experiencing within the womb of the mother. So Moran's interesting, talking about something that is not straightforward intersubjectivity, but intercorporeality, namely the manner in which lived bodies interact with each other. That's an important and quite radical shift of perspective, because the point is not of subjects, so it's not intersubjectivities, but it's all about bodies, intercorporeality. So it's a sort of step back from an odor-centric understanding of what the relationship with other means. And this is something that also really resonates with studies and research brought by cognitive scientists, for instance, Anna Czarnica, who actually states that our common understanding of intersubjectivity so far has been odor-centric and vision-based. So that's two elements and features of intersubjectivity, I think, that really show why that professor brought to me that kind of objection towards pregnancy, because pregnancy is not about, relationship between adults, and that's quite problematic, but I would say that it's not phenomenologically immediately vision-based, even if, of course, technological intervention and specifically ultrasound changed a bit the scenario. So what is this intercorporeality, and why we should want to bring this concept into the dialogue with intersubjectivity? So human selves find themselves within an intercorporeal dimension even before their birth. And conversely, the gestating self has some experiences of the fetal other as living organism inside her, namely kicking, moving, and being within her. As you may see, actually, this point of living fetal other, so the fetus as living organism, doesn't open, the door to some straightforward and, let's say, cutting edge bioethical implication. We're talking about living organism, we're talking about living being, and we are simply telling that there is an intercorporeal dimension that we participate, both as fetuses when we were in that stage of life, and for whom actually gestate itself. And the very fact that human being participates in intercorporeal forms of mutual exchange already in utero means that, I quote again Moran, and I mean, Moran really, the issue of intercorporeal pregnancy is not central to his investigation. So that means that really we are into something when we discuss this kind of topic. It says, I quote, the question as to which comes first, monadic egoic consciousness or intersubjectivity, is a false question. So if we want to say with that intercorporeality is the precondition of all forms of human sociality, intercorporeality becomes the background from which our being in the world is situated and also articulates the way in which we inhabit our own reality. So what's so special about pregnancy? Well, pregnancy is not a form, but I'd say now the form of radical intercorporeality, and the radicality of which consists in the coexistence of two beings in one body. This coexistence is not merely spatial, but rather it is experientially reciprocal and, again, not based in the domain of visibility. So we may have some preliminary conclusion, and then I move to the pregnancy motherhood debate, because I think I have no too much time to stroll around. So this idea that human beings participate in intercorporeal forms of exchange in utero, what does it tell us? That intersubjectivity is not entered into only by abstract egos of adult human beings, but that as human beings, we participate to a liminal state that is exactly the one of pregnancy. So till now, with very few exceptions, human being has been studying the self, no, the self with a capital letter, in the steady state of adult. But to be true, what the self is the continuous changing of also our pre-personal experiential layers. And again, I use this very interesting, I think, and powerful quote from Anatomica, that our most fundamental way of inhabiting the world involves peripersonal senses, I quote, such as tactile, proprioceptive, visceral, olfactory, and auditory inputs, upon which visual consciousness later builds. So pregnancy is not motherhood. So we talked just a little more about, intercorporeality and intersubjectivity. And my goal was to show you that there is another way to see intersubjectivity and to understand or even to question how, as human beings, we interact with each other. But what I also found equally important in, let's say, setting the tone of investigation is to present this distinction between pregnancy and motherhood. Also, you may see that there is a link with the intercorporeality, intersubjectivity distinction. Motherhood, in philosophy at least, is not a topic that really, let's say, is a classical in Western philosophical research and explorations. And in some sort, we understand motherhood again into the intersubjective framework. And we may want to do that, even if it's highly problematic for several reasons. The first reason is that we do mattering not only of other adults, but also of infants and babies, and other subjects that are not so central in Western philosophy. But we may want to stay with motherhood and intersubjectivity. We can't do that with pregnancy. We can't describe pregnancy as an intersubjective encounter and as with the, let's say, toolkit of intersubjectivity. And what is interesting, and another further argument to me for considering pregnancy as an experience per self, is that sometimes pregnancy is considered as a preparatory phase before motherhood, so a transitory stage leading into the acquisition of a new identity, the one of the mother, and also as the material and affective experience of having a child. So this correlation is, and I don't want to bother you with all still anecdotic, but it's not an essential constraint. Being a maternal subject and being a pregnant self are not, let's say, two sides of the same coin. We're talking about two different experiences, and this philosophical exercise to distinguish it prove it very fruitful in better understanding pregnancy and motherhood. So one could experience pregnancy and not being a mother, like pregnancy may end with a childbirth or may end up with an abortion or an early loss. And conversely, being a mother does not presuppose as a precondition having carried a baby, as the case of adoption well shows. Adoption is also surrogacy. So why this theoretical move may be for us interesting and even, I'd say, ethically important. This move liberates the analysis from psychologistic assumptions about the supposedly welcoming female body and the desire of every woman by nature to become a mother sooner or later in her life. So, we got some gender biological essentialism back there. And pregnancy may be a joyful rite of passage towards motherhood, but this is a contingent norm. And this norm is continuously disevolved by the morphological variety of concrete gestational experience. So this posture, that is not only a theoretical position, but also, I'd say, an existential posture, has some ethical implications. First of all, that we may actually distinguish between the existential experience of pregnancy and the social institution and identity of mother. And this is quite challenging because the moment you got pregnant, especially in neoliberalism and Western society, you are a mother and you're expected to behave like this. And this is something that we may really want to challenge at some point. So the fetus is not the baby to be. The embryo and the fetus are stages of biological development, and the pregnant self may want to have or not relationship with them. The pregnant person is a pregnant person. She's not a mother. She has no maternal duties. She is a person who is pregnant. And the output is that parenthood is a broader concept that encompasses also biological pregnancies, but includes other experiences like surrogacy and adoption. And that's the other side, being pregnant is not a destiny into motherhood. This is our way to liberate our own experience of pregnancy from some presuppositions and biases and beliefs that are not intrinsic to the experience, neither to the intercorporeal relationship, but to something that different kind of societies and political agenda want us to believe. Thank you.
Thank you so much, Nicole. This was fantastic. Thanks for reminding us about these points. And it's curious